Chairman, dear colleagues, what we will talk about today is not about the materials. I'm not here to try to sell you the product, okay? And I don't want you to focus too much on the product. What I'm trying to show you is the methodology of the statistical analysis, all right? So, I'm a professor in HTA, Health Technology Assessment, and we are doing a horizon scanning. Horizon scanning means that I want to see if something is worth the investment before I go on in the production. Okay? Before I get into the market, we evaluate technologies if we should buy or we should produce, and we want to know on the horizon before we actually have this device if it's good or not. And what I will show you is the statistical methodology to do that. In this case, we are talking about technology on infection and sepsis and helps to prevent it. As we know from the data and from the literature, sepsis is not a good thing. It's something that can kill the patient, and it has, of course, everywhere, even in Italy or in other countries. But what is important, we start from a bacteremia. That means that we have some bacteria in our blood. It can happen often after like dental surgery, or like in this case about central venous catheter implantation or dialysis catheters. Okay, and we can see that in 35% this bacteremia can become sepsis, and sepsis brings not only risk of death of the patient, but also cost. This is a German paper. Well, it tells us the average cost for a septic treatment. So, a patient in the ICU with a sepsis costs us 1,300 euros a day. And if the patient at the end is dead, it costs usually 25,000 euros total, and if he survives, 21,000. So it's quite a big cost for one patient. This is the device. It's quite simple. It covers the ends of this central venous catheter, and using a sort of gel, protect from the bacteria going in. The cost is quite low. It costs only 8 euros. This is the device. This is the website of the producer, and this is our study. So, we want to know if something is working soon, now, even faster than now. And we have to know how. And in these cases, we took a time series. So here we can see from December 2006, every month, the quantity of sepsis cases. We go back in time for a long period, 2006. That means that to 2012, it's 6 years, months by months. Because we want power in our statistics. We want a lot of data. Okay? And we only have 4 months checking. Okay? And most of you will think, well, 4 is not a lot, is it? Usually we are using the statistics before and after. We need 2 big groups and a lot of times. So what we have done is say, okay, this is number of cases, but depends on how many patients are in the ICU. It can change. Right? So we made a ratio between the number of central venous catheter implants and the number of sepsis. It's similar, but it's not the same trend. And you can see that actually reflects what is the literature. Remember, it was between 10 and 35% of CVC implants, and we actually are here around 30. So we are in the literature. Sometimes higher, sometimes lower, and the average is 35. And this is a time series, and the red dots are still our experiment. When we test this device on all the patients, of course there is no ethical points here, we're just testing on the central venous catheter. So this is time series analysis, and we see that there is a trend, stable trend, maybe decreasing a little bit. It's decreasing every month 0.04, but it's not enough. Suddenly, these statistics tell you if there is a change on the trend. If something is changing, on things, how things are going. And it's telling you if there is an angulation, or 0, 1, or more angulations, and also tells you where in time is the angulation. That's also important. So here we have the statistical analysis with the p-value, and as you can see, the computer analysis shows us that there is a joint point, an angulation, exactly here when we introduce the device. Not before, not after. Of course, there can be an interval of confidence. It can tell you the months before or after. But of course, if we could find like an angulation here, that was not related to our series. Okay? So it locates the angulation, tells you that there is only one, not 0, not 2, not 3, only one, and it's located here. So now we know that this device changed the results in the ICU. So what we have done is see if our investment was good enough. So we took the number needed to treat. Number needed to treat is our well-known formula. It tells us how many patients we have to treat before we save a life. So in this case, these are our patients. This is the formula, and this is the result. It's 3,7. That means that every 3,7 devices, we avoid one sepsis. Okay? We do not avoid all the sepsis. We just avoid one every 3,7. Let's say 4. So this is a return on investment. How much money I get back from the investment. And in this case, the cost of investment, that is here, is related to the gain of the investment. So let's change the gain of investment is what we save actually. We save, okay, we can calculate the life. Okay, I don't give a price of the life, but we can calculate the money that we are spending from the previous papers, the German one, remember? So the average cost of the patient is what we gain, and here is the cost of the unit, 8 euros, for the number needed to treat, what we invest. We invest 4 devices of 8 euros and we save this money. And this is the return on investment. For that person, that patient, it's 85,000%. 85,000%. And if the patient, for the survived patient, was 74,000%. Okay, now, how much is normally a return of investment? Because probably not all of you are familiar with the return of investment. Return on investment is not usually very high, and usually the place where is the highest is the stock exchange market, because there is high risk and high revenues. Okay, and usually a good investment with high risk is 7%. 7%, and we have 85,000%. I would invest on this. Conclusion: the device proved to reduce the incidence of sepsis by 25%. Improving the quality of care of the patient in the ICU settings. The return on investment, as I show you, is enormous. The CardioEnergy we can say that is an effective and efficient device in the protection against bacterial colonization. Thank you very much for your attention.
Is there any question or comments? Yes, please.
I mean, the graphic that you showed us.
Here we go back to the graphic.
And the angulation.
Yes.
You checked within 65 months all cases.
Yeah.
No, another.
This one.
This one, yeah. You introduced but your device in the last few months.
Yes.
And but this is not comparable. I mean, this curve landing is very speculative because there are not too much data to compare before 62 months all cases and with the patients group of last 5 months.
What you are telling me is a different point of view because you are used to standard statistics. Standard statistics borns with the brain of the person. And you can do it with the computer, but you can do it with your mind. With this one, it takes maybe 4 hours by the computer with the full power. And we are talking here about permutation tests. So the computer will analyze step by step and compare each one of these in a statistical way and check all of them. So you cannot do with the pen. And what you're telling me is what usually people think is before and after. There is no before and after here. We are testing if there is a modification of the trend. The angulation here, the computer decided. It's not me. The computer decided suddenly there is an angulation. It could be here or there. Sometimes there are 2, 3, anything. But the point is that there is no before and after. The computer says there is an angulation, it's there. Then I speculate that it's the same moment. And it's a different approach. This analysis came out only 5 years ago. And you can say on the other hand, so if it's not so new, it's not good. Or maybe it's not well tested. Well, actually it's been published in a lot of papers because it's how you calculate the different trends in oncology on the American database for oncology. The biggest database we have. And this is how they see if, for example, an intervention, like for example, a campaign against smoking is affecting the population because it doesn't take a lot of time to see it. You can see quickly if there is a change. And the power is done by the long time before. So I have a huge quantity of data that reflects. And I can tell you this already a lot. Imagine that if you go higher, it takes even more time to analyze because it analyzes step by step. And you can see here the permutation, number of permutation, 4,500. So he made for each couple, 0 against 3 joint points, all these permutation tests, and tells you the p-value that probably there is 0 joint point against 3. 0 joint points, so no angulation against 2, but then 1 wins over 0 with this p-value. And as you can see, the p-value is huge. Actually, not huge, it's very small. That's what we want. It's 0,006 and so on. So it's very significant. It's a different way of approach. I know it looks like before and after, but that we need a lot of data, a lot of time. With this, you don't. And it's reliable and it's used in medicine, in oncology, on the hugest database that we have in oncology.
Sorry. So it means that you don't need randomized control trial?
No. The structure of the experiments is different. Because I'm not comparing product A against product B.
Well, you are comparing one strategy against another strategy.
Yes,
If for example,
but-
two
but-
devices.
But see, into the devices, you don't have the trend. This works only with trends. If I don't have the trend, you have to find out the trend, and then you can use this. But if you don't have a trend to analyze, 2 groups don't have a trend. So you cannot use it. It's just a different methodology. You need a trend. You can see, for example, if you give some pills for hypertension, if the pressure goes low. But you can see if there is a difference, statistical difference. But you cannot compare. We check difference in the trend, not comparison. So it's a different approach. I know that it's a little bit hard, but this is why we are here talking at the Congress. Something new, and that's why we are in the innovation area. So it's something it's called interrupted time series. It's a different approach.
Any question? If there's another question, thank you very much again.
Thank you very much.
The session has finished.